Hello, my name is Dianne Burnett, and I am the Director of Marketing and Communications for Grace Health System in Lubbock, Texas. I was invited to participate in today's Healthcare Leadership Symposium at West Texas A&M University and speak to healthcare communication managers. I'd like to start today with a quote from Anne Lamott, the author of Stitches, a handbook on meaning, hope, and repair, in which she says, "Gravity and sadness yank us down, and hope gives us a nudge to help one another get back up." Oncology nurses provide that hope, but we often question, can hope and empathy be taught? We're going to dig a little deeper by discussing an article called Responding Empathetically to Patients, Development, Implementation, and Evaluation of Communication Skills Training Module for Oncology Nurses from an international journal. This is by Cassandra Fearson, Smita C. Banjari, Ruth Manna, Megan Johnson-Sheen, Nessa Coyle, Carol Kruger, Erin Maloney, Talia Zader, and Karma Byland. This article was published in the Patient Education and Counseling, or the PEC, which is the official journal of EACH, the International Association for Communication in Healthcare, and AACH, the American Academy on Communication in Healthcare. To assist in their medical journey, but their emotional journey as well. They offer infusions and a dose of hope. The paper evaluated the success rate of customer service training for inpatient oncology nurses and if it increased their empathetic responses and interactions they provided to their patients. 248 nurses at a U.S. cancer center were evaluated for the study, and pre- and post-standardized assessments were given. The nurses were questioned on how confident they were with their empathy skills with their patients. Results indicate that nurses were satisfied with the module, reporting that agreement or strong agreement to 5 out of 6 items being assessed, or satisfaction of 96.7% to 98% of the time. Nurses' self-efficiency in responding empathetically significantly increased from pre- to post-training assessments. Additionally, nurses showed that they had empathy skill improvement in the post-SPAs, as well as patients. They also said that the nurses provided more empathetic care post-training. Finally, 88.2% of the nurses reported feeling more confident in using the skills that they learned post-training and reported an increase of 42 to 63% in use of specific empathetic skills. A few points of the study that reminds us of things mentioned in our textbook is that patient-centered communication can help drive treatment planning. Nurses' ability to demonstrate empathy to their patient can help with their patient's openness to a treatment plan. It can ultimately help determine if that treatment plan will be successful or not. Patient-centered communications in cancer care is especially vital because these patients are facing overwhelming odds and oftentimes will self-disclose information to their nurses that they don't necessarily disclose to their physician. There's also many times that they offer not just verbal cues, but many nonverbal cues to the nurse in which if they are practicing proper empathy, then they can actually pick up on those cues and ask for more insight from the patient on what's going on. Knowing the importance of empathy, the authors developed their training module, Responding Empathetically to Patients, based on a conceptual approach and focusing on 3 main sections. Those modules included 1. Responding empathetically to patients, 2. Discussing death, dying, and end-of-life goals of care, and 3. Challenging interactions with families. Of the 248 participants of the study and the training, 99% were female and 1% were male. The training consisted of workbook, video presentations, and role-playing. Although the post-training and overall results showed the participants as well as patients found the customer service training helpful, I believe that there are some real-life challenges not taken into account for the study or the customer service training. I believe in order for a successful rollout of any training program for this select group of nurses, we must take into account the day-to-day challenges that could interfere with proper empathetic care. For example, burnout is a huge factor in oncology nursing. These nurses are facing facing patients in their less than best state and are having to deal with that related sadness. They are constantly having to be strong for their patients, which in reality can take a toll on anyone. The nurses should be offered perks to help combat that burnout. Maybe special recognition programs, break time massages, mental health days, little things that help them feel recharged. Not something a training could possibly fix. As Elijah Legacy in her essay on CureToday.com mentions, oncology nursing is a calling. It's not just a job. If a nurse is feeling that it's not her calling anymore, no amount of training will ever make that better. I strongly believe that we shouldn't just put all the responsibility of providing empathy and hope on the shoulders of nurses. I really believe that we should start fostering that hopeful and empathetic environment from the moment that the patient walks into the building. For example, we at Grace, we provide our patients with warm socks, snacks, magazines, and lotion when they arrive for their chemotherapy. That helps provide that empathetic and hopeful experience from a system level and not just all on the nurses. Also, how accurate are the responses given in the post-assessment? Did the nurses really feel the training worked? Or they just select better choices so they didn't have to be bothered with any more training? How honest were the patients? Did they feel that there would be repercussions if they didn't say that the nurse was providing more empathetic care? All of these post-assessment questions could be subjective, and I'm not convinced that they could be reliable and prove that the training was successful. Taking into account everything discussed today, I would like to leave you with a few questions to ask yourself to help better equip your oncology nurses. First of all, what's your initial thoughts on the study and the training? How could you be helpful if your team is experiencing burnout? What ways could you encourage and support your team as they give so much of themselves to others? Also, what could you do from a system level to help your patients feel infused with hope? And also, if training is something that you're interested in doing, what training can you implement fairly quickly for your oncology nursing team? Thank you for having me today. Please feel free to contact me with any questions that you might have regarding today's presentation.